Okay, this video is called Is Psychiatry a Joke? This is part 2. And where this lecture comes from is that I was reading about Parkinson's disease, and of course I remembered MPTP. Some heroin addicts made this synthetic heroin where they screwed up and they made this MPTP compound, and it immediately caused Parkinson's disease. And it was a mitochondrial inhibitor of complex 1 on the intermitochondrial membrane. And I just sort of read this again. I already knew that, but I read that again in some book I'm reading. Oh, yeah, in this glutamate book, the one I was reading by Mark Madsen. I did a book review of that recently. Anyways, the reason I mentioned it, I'm like, well, gosh, I just looked up all these mitochondrial inhibitors, and I remembered that, of course, Haldol is a complex 1 inhibitor of mitochondria, the beginning of the mitochondrial electron transport chain. But guess what? Well, and first of all, Haldol is an antipsychotic medicine, also called haloperidol, and they even jokingly call it in the emergency room vitamin H. Okay, so, and of course we know that antipsychotic medicines, they're very commonly cause Parkinson's disease, all right? But then, I recall that, gosh, many serotonin selective reuptake inhibitors, SSRIs, they also inhibit complex 1 of mitochondria. Okay, as does chromium, which is sometimes recommended to patients, and mercury, which is sometimes used as a preservative and a common contaminant of high fructose corn syrup. Trichloroethylene, which causes Parkinson's disease, is an inhibitor of complex 1 of mitochondria. Okay, and then here's the funny one. I've had some of these doctors tell me, oh, what do I think of metformin for increasing longevity? I said, are you stupid and retarded? You're going to take a mitochondrial inhibitor? You think that's going to make you healthier? Lasix has some, that's a common diuretic, some inhibition of this. PCBs, common in seafood. All right, so what am I getting at? Well, I figured, obviously, if antipsychotics like Haldol are inhibiting complex 1 and they're causing Parkinson's disease, well, maybe these SSRIs are doing the same thing. So I'll go into more detail in a sec, but the point of all this is a lot of these meds, they're not just bad, they're biologic poisons, okay? So, of course, we know about Parkinson's being caused by antipsychotics like Haldol and some other antipsychotics. So, if you go in the literature, it'll say it right out in front. Parkinson's disease is a common side effect. So, I want to make that clear. It's expected the patient will have a high chance of getting Parkinson's disease when you put them on antipsychotic medicine. That's the common result. And wait till you see what the alternative is. You're gonna laugh. It's so good. Okay, so here's another article about drug-induced Parkinson. So, of course, commonly caused by all these antipsychotics, and there's a whole bunch of them. It's not just Haldol. All right, now here's where it gets even more interesting. Mood stabilizers like lithium, very commonly used to treat bipolar disorder. Lithium can cause Parkinsonism, okay, and it can cause a lot of other problems too. Now, here's some more antidepressants. Selective serotonin reuptake inhibitors, okay, including the famous fluoxetine, and that's like flu for fluoride, another brain poison toxin, okay? And then some of these anti-epileptic drugs, they slow your brain down too much, you get Parkinson's disease. Trust me, I got a good surprise here, this next slide right here. So this is Soteria. Soteria means deliverance in Greek, to be delivered from mental illness. Okay, now this guy, Loren Mosher, he was like the head psychiatrist in the National Institute of Mental Health, and he had, from his experience, noticed that a lot of times the schizophrenic patients, they do better if you don't put them on drugs at all. So he set up a program like in the San Francisco area, and it was replicated in other areas where the schizophrenic patients, they would try not to put them on any drugs at all. And they would just have residential supervisors in assisted living apartments. Okay, and what they found was the number of these patients that could return to civilization, so to speak, and function independently, maintain a job, maintain a marriage, that sort of thing, was very high. It was around 90% of them. It was extraordinarily high. Versus the ones that had been treated with, antipsychotic drugs, it was incredibly low. It was in the ballpark of like 10% or something, maybe 15%. It was really bad. And those antipsychotic drugs, they're terrible drugs. They're major metabolic poisons. So what I'm trying to say is, all you got to do is be nice to the person, have a supervisor. They might need a little time to work through their thoughts, but they often do quite well and can return to civilization and independent function. So, Soteria. So what do you think happened to Mosher? So here's this guy, does this genius achievement, should win a Nobel Prize. Everyone should thank him. So the he gets fired from the Institute of Mental Health. He gets accused of being biased against drugs. They try to ruin his career. And that's typical. When somebody does something good in healthcare, you get punished for it. That's why I think geniuses, maybe they shouldn't go into healthcare, or go into healthcare in a field where you don't get punished for being smart, okay? Like some of the surgical fields are pretty good, and there's some other fields where you can still make a good living and not be hassled too much. But it's rather remarkable, you know. The guy comes up with a cure for schizophrenia, and he gets fired. Okay, different effects of SSRIs. So these are antidepressants. And there's a whole bunch of them. All of the antidepressants in this research study, they all inhibited complexes 1 and 4. These are electron transport complexes on the intermitochondrial membrane. And we know that if you inhibit complex 1, you increase your risk of Parkinson's disease. So it's rather extraordinary, isn't it? And they could even be shown sometimes to be inhibiting complex 2. All of the antidepressants inhibited complex 1 and 4. Isn't that remarkable? So these are drugs given to some poor, person who's going through a sad time in their life, depressed, and basically they give them a medicine to poison their mitochondria, which of course increases the risk of excitotoxicity because you need lots of ATP to pump out calcium when you got other things stressing your brain out like caffeine, sleep deprivation, psychological stress, MSG, aspartame. And so instead they give them a poison that weakens their mitochondria and predisposes them to losing brain cells, apoptosis. How stupid is that? Okay, use of antidepressants and the risk of Parkinson's disease. Oh, here's a good one too. They say, well, these patients who got Parkinson's disease from their antidepressant, maybe it wasn't the antidepressant. Maybe their depression was just an early presentation sign of their Parkinson's disease. And what kind of BS is that? It's just another way to blame it on the patient instead of blaming it on the drugs. I tell you this stuff and I give you these lectures because I'm trying to help you. I'm trying to protect you from the system, which is really pretty dangerous, isn't it? All right, case of SSRI, antidepressant-induced selective serotonin reuptake inhibitor induced irreversible Parkinson's. So here's some poor guy put on Prozac and sertraline, and he got irreversible Parkinson's. Young guy, he was only like 29 years old, this guy. Okay, so getting back to it, like I said, the SSRIs, in different papers I found them, a bunch of them inhibiting complex 1. I've also found them inhibiting complex 5, which really, ATP synthase. Fluoxetine contains the fluorides, while F- inhibits complex 4. We know that excessive dietary fat, especially saturated fat, inhibits complex 3, causing diabetes. And that's also makes you wonder if this might be related. People say, what about statins? Well, they cause decreased function electron transport in this region around coenzyme Q, and the statins can potentially increase the risk of diabetes. So what I'm saying is, just eat a low-fat, low-sodium, 100% vegan diet, organic only, no meats, no sweets, no oils, no alcohol, and you're getting the good stuff with all the benefits without all these potential side effects and pitfalls. And here's your PUFAs, omega-6s, for example, producing toxic aldehydes, and that's inhibiting this. So anyways, these drugs are really bad, really dangerous, much worse than people realize. Now, if you're interested in a book that's the best summary of the side effects of psychiatric drugs, it would be Peter Bregin's book. This guy was a Harvard-trained psychiatrist. He's a brilliant guy, and he did a lot to really help people. So this is his most technical book. He's written a bunch of other books, but this is the most technical one, Brain Disabling Treatments in Psychiatry. I read it cover to cover. It's a great book. He has some lectures online as well. Okay, and he said there aren't any psychiatric drugs that improve the brain. They all cause brain damage. And so here's my joke of a drawing. Basically, some poor guy goes to a psychiatric department, and they're all predisposed to putting the patient on drugs. And in Bregin's word, basically all the psychiatric drugs, he said they're a chemical lobotomy. It's a gradual, slowly worsening chemical lobotomy. That's what they are. You're going to be damaging neurons, losing neurons, and that's a topic for another day. Okay, then you can get a surgical lobotomy. They'll cut out part of your brain or stick an electrode into it, or they can put you through electric shock and give you an electrical lobotomy. If it was me, I would run for my life in the opposite direction. Okay, that concludes. Actually, I will just read you one quote from Bregin's book on page 7. He says, the currently available biopsychiatric treatments are not specific for any disease. They don't really fix a neurotransmitter. They don't really specifically respond to a disease, okay? It's like Parkinson's disease. If you release L-DOPA, you give them L-DOPA, carbidopa, whatever, you're giving them something that will potentially replace what they're deficient in. But with the psychiatric drugs, that's not the case for any of them, okay? And he says they do not correct any brain abnormality. They said if a patient is suffering from a known physical disorder of the brain, biopsychiatric treatment can only worsen it or add to it. Okay, so that's pretty good. So anyways, that concludes Is Psychiatry a Joke? Part 2.